Hello, this is Alyssa again. I will be doing my sterile dressing competency. So first I would have my dressing. I would take off the old dressing. I would assess for color, the size and the depth, and I was also look and make sure that the patient is any type of pain before I start doing a new dressing change for that. And then I'm gonna get my supplies. I have my ABD pad, my sterile field, my 4x gauze, my boat of gauze, tape, normal saline, and my Q-tips, and then of course my sterile gloves. So I am going to go ahead and get this tape ready. Okay, so first I am going to lay my sterile field. Okay, so I have my sterile field, and I'm gonna go ahead and get my supplies. My boat of gauze will not be on the sterile field. Then I have my saline. And for the sake of the video, I'm just going to reach over the sterile field and I'm going to show you, I will pour the saline into the boat of gauze. Now I'm going to put on my sterile gloves. So I'm going to show you, I'm putting on my sterile gloves. I'm going to turn the camera so I'm not doing it over the sterile field. Okay, so here's my boat of gauze. I'm going to gently open it like this. And gently open it like this. Going to take it. And then I'm going to get my other one. Now I can maneuver around and maneuver it. Okay, and we are going to turn back to the sterile field. I would not touch the chair with my sterile gloves, of course. I was just moving the chair so that way we can come back to this. Okay, so I'm going to get my wound. Like again, I'm gonna get a Q-tip and I'm gonna assess the depth and the width of the wound. Then I am going to throw this out. Then I'm going to get my gauze and I'm gonna make sure that this gauze doesn't have too much water on it. We don't want it to be soaking. So I'm gonna squeeze it out. Then I'm going to open it up. Make sure. And then I'm gonna get another Q-tip and I'm going to gently put it in there. Making sure that I'm not aggressive with it and I'm not poking the wound, just doing it gently and making sure that all the gauze is in there. And there we go. Put this up, and then I'm going to get my 4x4 sponge, 4x4 gauze, and then I'm going to place it on here like so. And then I'm going, my pad, just gonna fold a little bit, just because of this small, and we're just gonna put it on here. Perfect. Like this. And we're just gonna leave it right here, for now. And then I'm gonna go ahead and get some tape. Okay, put this back on here. And then we'll get the tape. And we'll just do the ladder technique. Okay, here we are. And then I would get another piece of tape and I would put my initials, the date, and the time on the piece of tape, like so. Here we go. Once that is done, I would clean up the area. Not only would I do that, I would make sure that the patient, how the patient tolerated the procedure. Also, I would document what equipment I used, the size, the color, and the drainage that came from the wound. And I would just make sure that I wouldn't break the sterile field. So I would make sure that the boat of gauze is outside of the sterile field. I would make sure that the tape is outside of the sterile field. For the saline, I would make sure that that has a date and a time on it. And if it was past 24 hours, I would just throw it out and get a new one and date and time that. And then I would also pour a little bit out. If it's not past due, I'll pour a little bit out, and I would just go ahead and start with the fresh saline that I have. Like I said, we just always look at the doctor's orders to make sure that we are using the correct equipment. So that is all.